Today, I am confirming that fully vaccinated New Zealanders will find it easier to come home from January, and foreign nationals follow from April onwards, as we remove the requirement for managed isolation and quarantine for most travellers arriving into New Zealand. There will still be carefully managed processes for recent arrivals, including a mandatory 7-day self-isolation period for people who are not required to enter MIQ. The 3 steps will be: from 11:59pm on Sunday the 16th of January next year, fully vaccinated New Zealanders and other eligible travellers can travel to New Zealand from Australia without staying in managed isolation or quarantine. From 11:59pm on Sunday the 13th of February, fully vaccinated Kiwis and other eligible travellers can travel to New Zealand from all other countries. And then from the 30th of April onwards, fully vaccinated foreign travellers will be able to travel here, and this reopening step will happen in a staged way. Closing our border was one of the first steps we took to keep our country safe from Covid-19, and it will be one of the last things we do in terms of opening up, following our transition to the traffic light protection framework and the lifting of the boundary around Auckland. We do know that the international restrictions we have had around our border have been tough for many people. That's why we're making this announcement today, to give families, businesses, visitors, airlines, airports and others the time to prepare. All travellers will require a negative pre-departure test. They'll also require proof of being fully vaccinated, a passenger declaration about their recent travel history, including that they haven't been in a very high-risk country in the past 14 days. They'll be required to do a day 01 test on arrival. There'll be a requirement to self-isolate, and they'll be required to complete a final negative test before entering the community. I do know, and I acknowledge, that some people and businesses want us to open up before Christmas, and that is very understandable. Others want us to be more cautious and take even longer to open up. There does continue to be a global pandemic, with case numbers surging in Europe and in other parts of the world, so we need to be careful about reopening of our border. That's why we're doing what we've always done, and that's to follow the expert advice, which shows us that the border continues to be one of our biggest risk areas for new cases. For example, our current outbreak, which is now over 7,000 cases, stems from one single traveller coming into New Zealand from Australia. We've always said that we would open the border in a controlled way when it is safe to do so. We started that by halving the time spent in MIQ to 7 days, and we've been moving to a 7-day isolation period for fully vaccinated, and now moving to a 7-day isolation period for fully vaccinated travellers will provide continued high levels of confidence around the risk associated with new arrivals, which is also important. A phased approach to reconnecting with the world is the safest approach to ensure that risk is carefully managed, and it reduces the potential impacts on vulnerable communities and on the New Zealand health system. Our opening of borders will logically follow the bedding in of the traffic light system, the lifting of the Auckland boundary, time for regions to get their vaccination rates higher still, and of course for booster shots to be rolled out to those who received their first vaccinations over 6 months ago, which includes many of our over 65s. The 3 steps that we're announcing today constitute a new medium risk pathway. Those who don't meet the requirements for that medium risk pathway, but are still permitted to enter New Zealand under our current border settings, will continue to enter MIQ on arrival under the new regime of the 7-day managed isolation, followed by 3 days of home isolation. And that'll include those who don't meet the vaccination requirement, which includes unvaccinated New Zealand citizens, and those who are coming from very high-risk countries. So, on very high-risk countries, I can also announce today that Indonesia, Fiji, India, Pakistan and Brazil will be removed from the very high-risk designation from early December. Travellers from these countries will be able to enter New Zealand on the same basis as travellers from most other countries. That'll allow New Zealand citizens, those with residence class visa holders and other travellers eligible to come to New Zealand under our current border settings to travel directly to New Zealand. Papua New Guinea will continue to be classified as a very high-risk country, so therefore only New Zealand citizens and their dependents can travel directly to New Zealand from PNG. All travellers from Papua New Guinea must spend 14 days in a all other travellers from Papua New Guinea must spend 14 days in a non-very high-risk country before coming to New Zealand, and exemptions are still available for humanitarian reasons. So I want to end, before I hand over to the Director General, by acknowledging the very difficult trade-offs that we've needed to make to keep our country as safe as possible over the last 2 years. We acknowledge that it has been very tough. Families have been separated. People have found themselves having to shelter in places they did not expect to stay for prolonged periods of time, and we are acutely aware of the impact that these restrictions have had on individuals' lives and their livelihoods. As I've said, standing here many times before, when it comes to COVID-19, there are often no easy decisions, and we've often been faced with the task of making the least worst decision, because we know that whatever steps we've taken, there have been consequences and people's lives have been affected, and the border is clearly an example of that. So as we move into 2022, we know that the pandemic is not over and it's not going to suddenly end, and we only need to look at Europe to see that the path out of the global pandemic is not a straightforward one. Today's announcement does not mean that the MIQ as a system is going to end anytime soon. MIQ is intended to be a temporary measure, and its current scale and the way it operates has served us incredibly well, with more than 190,000 people brought home since our border closed in March 2020. These announcements today will free up more space in MIQ, and we will be intending to use that space. So today, and largely thanks to the vaccination rates and the incredible ongoing efforts of Kiwis, we're in a much stronger position than we were just 3 months ago. And as we shift into the new phase of managing the pandemic, the time is right to carefully start the reopening of our borders, just as we said that we would and just as we have planned for.
And today there are 215 new COVID-19 cases in the community to report. Of these, 181 are in Auckland, 18 are in the Waikato, 3 are in Northland and 12 are in the Bay of Plenty. Additionally, we are reporting 1 historical case confirmed in Canterbury. In terms of hospitalisations, there are 87 people in hospitals today. All but 2 of these are in Auckland regional hospitals. There is 1 in Waikato and 1 in Rotorua, and there are 8 people in ICU. They are included in that overall figure of 87. So I was asked on Monday about the vaccination status of people who have died during this outbreak from COVID-19. What I can say is, of the 15 deaths to date, we can report 10 of these people were unvaccinated. 2 of them had had 1 dose less than 14 days before they contracted COVID-19, and 3 were fully vaccinated. That is, they had been vaccinated more than 14 days prior to being diagnosed as a case. As I've mentioned before in this forum and in a separate briefing on the 16th of November, as our vaccination rates rise, so somewhat counterintuitively will the proportion of both of cases, hospitalisations and deaths rise amongst those who are fully vaccinated. This is just by virtue of the fact that our vaccination rates are so high. And even though the vaccine is more than 90%, in fact more than 95% protective against death from COVID-19, it does mean we will still see some fully vaccinated people, sadly, will die. Now, we will update these figures periodically as privacy allows, probably when we get another 10 or so cases each time, because if we update them with individual cases, that, of course, can compromise privacy. I now have just got a couple of slides I want to show, so our interpreter might move to the side while I do that. Thank you, Alan. So I showed a slide 3 weeks ago, and this slide shows essentially what's happening with average case numbers. That's the blue line. It's a three-day rolling average of case numbers, and it was showing different R values projected from the 1st of October out, and then what we thought the impact of vaccination might be on the average case numbers, and also how that would compare with the R value. So I've got the updated slide from just 2 days ago on Monday, and you can see that the rolling 3-day average of case numbers has levelled off. Now, this is just the Auckland region, I should say, but you can see it's now at or below that 1.2 R value, and very much now sitting within that medium projection. And the key point here is we are seeing that impact of those high vaccination rates across Tāmaki Makaurau, having a significant impact on case numbers, and we're also seeing that translate, as you will have seen, over the last 10 days or so into hospitalisations and ICU occupancy. So, finally, I do just want to emphasise that a number of our people hospitalised during the outbreak to date have been children under age 12. 42 children under age 12 have been assessed at hospital, and of these, 19 have spent at least 24 hours or longer in hospital being cared for. Of those, 1 was between age 5 and 12, 6 were aged 1 to 4, and 12 were under the age of 1. I just want to make the point that one of the best ways we can protect tamariki of all ages is for adults to be vaccinated, and there is very clear evidence that's protective, particularly inside households.